Welcome to our section on health and safety. In this section, you're going to learn about how to support people to maintain their safety and their health, how to get good nutrition, and understand the importance of personal hygiene and regular medical and dental care. You'll also learn how to watch for 8 health conditions that need special attention. As a DSP, you have important responsibilities for health and safety in home and community activities. Your agency will provide you with the processes that are used in day-to-day health and safety issues and what to do in case of an emergency. Additionally, many health and safety issues will depend on the type of program in which you work. For instance, DSPs who support people in employment or alternate day options and residential options play a vital role in carefully observing people and reporting any changes in their behavior, appearance, habits that might relate to health and safety. Residential staff members often have the additional responsibility of arranging for and accompanying many people to doctor or dental appointments. All programs have written guidelines to follow for health and safety and emergency situations and have procedures for reporting critical incidents. As a DSP, you need to become familiar with all of the protocols for your agency. In addition to the information in this section, you will likely receive first aid and CPR training, as well as health and safety training related to your specific agency, to assist you in helping people stay healthy and safe. You may also receive training and be tested in procedures for safe administration of medication. This chapter is not intended to replace that training. Your role is to help the people you support be safe in all situations, to access quality health care when they need it, and assist them in learning and using skills that maintain health and safety, and help them to be aware and informed regarding their own health and safety concerns. People with disabilities have the same needs for good nutrition and proper weight management as people without disabilities. Since developmental disabilities are often associated with other medical conditions such as epilepsy, allergies, diabetes, heart problems, you may support people who are required to follow a special diet for health reasons or for food allergies. Fortunately, today there are a variety of food products available for many people who have specific food allergies. Many restaurants offer a range of meals and are accustomed to responding to the needs, likes, and dislikes of individual diners. Depending on the needs and interests of the people that you support, your role may vary. You may help people plan nutritious and well-balanced meals, or oversee meal preparation, monitor appropriate amounts of food, or encourage appropriate amounts of food, or assist in helping to make those healthy food choices when dining out. Your guidance and assistance will be especially important with aging adults whose nutritional needs and appetite and vulnerability to illness are often changing. Just as most of us hope to stay in our home as we grow older, so do the people we support. The supports you provide will play a critical role in helping to make that possible. These are some resources to help with good nutrition. There's a website, it's here at the bottom, kind of blocked out by my face, choosemyplate.gov. It focuses on variety, amount, and nutrition from all 5 of the different food groups: fruit, grains, vegetables, protein, and dairy. It includes beverages and foods that are less saturated in fat, have less sodium, less added sugars, and it focuses on eating the right amount of calories based on the person's age, sex, height, weight, and physical activity level. It's a really good resource. Check out the website below if you're interested. There's a lot of printables and posters that go alongside with that. Personal hygiene plays a major role in how others view a person. It's important for all of us to wear clean clothing, keep our hair clean and healthy, and bathe regularly, because people with disabilities are often seen by people as different. It's even more important to have good personal hygiene. Dirty clothing and sloppy appearances get in the way of meeting new people and making friends. When you're dressed clean in well-fitting, stylish clothes, we're more likely to be seen in a positive manner. It's possible that the people that you support might need reminders or guidance to maintain their personal appearance. Depending on their needs, you could be assisting with them physically bathing, shop for shirts. You could be helping them just remember, verbal reminders to brush your teeth every morning so they don't have bad breath. Others may need you to fully put on an item of clothing or fully put on their deodorant. It just depends on their level of support needs. But good hygiene and dental care is important for health reasons too. Lack of attention to bathing or to routine care of your teeth and your gums can lead to some serious medical conditions. Some of the people you support may or may not be able to understand that, or they may not like doing the activities themselves. Like brushing their teeth can be very aversive to some folks with sensory issues. It's your role to find creative ways to encourage participation in necessary bathing and brushing and shampooing and other personal hygiene activities if necessary. Regular medical and dental care is crucial in helping people enjoy a healthy life. Typically, appointments are scheduled and residential staff or family members accompany the person. It is important to work closely with each person's primary care physician and other medical and health professionals, psychologists, psychiatrists, specialists, dentists, to make sure that your individual is getting their regular routine tests, their screenings, an annual physical. DSPs often play an important role in communicating to the health professional what someone might be experiencing. You might be there to advocate for them or explain on behalf of your individual if they struggle to express themselves in those manners. You're going to be the one communicating that very vital information to the doctor. So a lot of people don't put as much thought into the dental care and focus on medical, but dental care is equally as important. Helping maintain a healthy mouth by regular brushing, flossing, routine dental visits can dramatically decrease health-related issues such as infections or discomfort or possible tooth pullings. Dental care is highly important. All DSPs should be on the lookout for changes in appearance or behavior that may indicate some symptoms of illness. Some people may not be able to fully communicate what they're feeling, whether it be a physical feeling or an emotional feeling. So it's really important to be diligent in your observation and monitoring and reporting of any of these changes. Look for changes in daily patterns, in how they look, in their bodily functions. That they use the bathroom or not use the bathroom for the last 5 days. Those are very important things to document and communicate with people in the support circle. And obviously look for changes in behavior. If you work for an agency licensed by DBHDS, you complete training and testing in the required medication administration procedures before administering medications. The course is always approved by the Virginia Board of Nursing. It teaches the safe and accurate administration of medications. Because it's one of your most important duties, you will perform as a DSP. Not every individual takes medication. If that is the case, you likely don't have to worry about that, but for the most part, most of our individuals do come with prescription medications that you are in charge of making sure that they take. Medication errors can cause great harm or even death. Therefore, it's essential that when giving prescription or over-the-counter medications, you follow procedures and safeguards, you follow a prescription, and the doctor knows what is being taken. Some people take multiple daily medications. All medications can have side effects, some of which can be pretty harmful. Side effects may indicate that the medication dosage or type may need to change. It could be reacting with a different medication. You should become familiar with how your person's medications affect them. Side effects are sent with the medication by the pharmacy and are maintained in the MAR, or the Medication Administration Record. It's important for you to know the side effects, for the individual to know the side effects, anybody in the support circle, so that everyone can be aware and can report a concern. For emergency care, it's best that all staff receive first aid and CPR prior to supporting people alone. That is a requirement. Here, you must have first aid and CPR before beginning work with an individual. Always call for help. In an emergency, you're calling 911 and you're following all program procedures, which typically involve informing your immediate supervisor, depending on the level of emergency, contacting the director, contacting additional family members. Follow your program's procedures, but always call 911 at the first sign of an emergency. In addition to potential for illness and injury, you may find yourself supporting people with ongoing health concerns or conditions such as seizures or Alzheimer's or sleep apnea, heart disease, visual or hearing impairments, mobility concerns, food allergies. All of these are ongoing health concerns. So each staff member needs to be aware of additional health concerns. So if somebody has seizures, to be aware of the signs of a seizure. If somebody has difficulty walking in certain situations or when standing abruptly, that should be written in their plan as an ongoing health concern, so that everybody is aware of the the risk fall when with difficulty walking. Everybody should be aware. Along with regular medical care and good nutrition, exercise is another important element for a healthy life. Many people have never experienced a regular exercise program. Though they may face some physical challenges, there are a variety of activities designed for older adults and for people with disabilities. Exercise can be fun, it can be exciting. Everyone benefits from moving more. Most health organizations recommend at least 30 minutes of exercise most days of the week. Swimming, running, walking, visiting a park, visiting a zoo, a walking trail, going grocery shopping, pushing the cart and reaching for items on the shelf, doing a dance while cleaning the house. Those are all examples of appropriate exercise. Assistive technology refers to any item, device, piece of equipment, or set of products that is used to maintain or improve abilities. So these are your custom eating utensils. For Parkinson's, if you're wiggly, they have custom eating utensils. Shower benches for stability in the shower. Communication devices if you're not particularly verbal. Picture boards. Those are all assistive technologies. It's the role of the DSP to learn how to use these effectively and properly to enhance the lives of the individuals that we provide services to. The reality is that we all are going to use some sort of assistive technology as we age. It benefits us all as we age. It might be one of the key elements in keeping somebody in their own home and community as they age. It helps maintain independence. As your physical and cognitive abilities change due to the aging process, it allows you to remain that kind of dignity and independence in allowing you to complete something yourself. If someone you support could benefit from any of the devices, mention it to the supervisor, mention it to their service coordinator, support coordinator, or family member, because it's possible that the item might be available through Medicaid or Medicare. There are 8 health issues that are often overlooked and need to be more carefully monitored. These conditions can be bigger problems and even result in death. Skin care, aspiration pneumonia, falls, UTIs, dehydration, constipation and bowel obstruction, sepsis, and seizures. The general process you follow: if health conditions are noted, you call 911, you talk with your supervisor, and you follow all agency and program procedures. Skincare is a big one. It's not something that people think about as a potential issue, but healthy skin aids in regulating body temperature and protecting our internal organs from injury and against the elements. Some of the signs of skin problems are pale, red, pink, bluish, any abnormal color skin, a rash, a cut, a lesion, evidence of parasites, a change in skin temperature, or pressure sores, which are a really big one. Pressure sores and bed sores are, especially for our folks who are not as mobile as others and spend a lot of time on their bottoms or in bed, the risk of bed sores is very high. To prevent skin breakdown, you can use adaptive items such as water, air mattresses, or foam mattress pads, elbow protectors. You don't think about it, but you could get a pressure wound from always being on your elbow or always having your wrist down if you're on it for long enough. So use adaptive items. Inspect the skin daily and note any irritation that you find immediately. Prevent friction on those areas when you're lifting and repositioning. Provide really good skincare. Keep it clean, moisturized, urine and stool free. If there's wound drainage, make sure that stays, clear and dry. And make sure to reposition the person frequently if they are in a wheelchair or bed-bound. You're always going to want to encourage activity and movement to lessen pressure on that spot and protect the bony areas with soft materials. People are more at risk when they're in a wheelchair or have problems sensing pain or pressure. They have a limited ability to communicate when they do feel those things. If they have circulatory problems, are very older adults, or are obese or very, very thin. Aspiration pneumonia is the inflammation of the lungs and airways to the lungs from breathing in foreign material, most commonly food, vomit, liquids, saliva, but most commonly food. The signs and symptoms are chest pain, cough, fatigue, fever, shortness of breath, and then bluish discoloration from lack of oxygen. Here's a little image to help illustrate that. Then we've got the people who are at risk for aspiration pneumonia. Most commonly, these are people who are less alert because of medications or illnesses. They have some sort of disorder of the esophagus. They have problems swallowing or have a poor gag reflex or are older. Falls are a really big risk that not many people consider unless somebody is in a walker, but the risk of falls can happen over anything. So falls refer to any situation in which someone descends or falls suddenly and involuntarily toward a lower surface of the ground. So a fall is a fall. A fall can result in a broken bone, a head injury, like really severe injuries, and could result in the need for home health care. Falls can be very scary. Factors that contribute to falls are health issues, medications, being sick or fatigued, having a cluttered room, wet or slick surfaces, no proper medical adaptive equipment, or even being shoved or running into something. People at risk for falls are usually the older folks, have a loss of muscle, folks that have arthritis or diabetes or skeletal problems, have visual or hearing loss, take medications that can cause gait concerns, or people who just are lacking the correct adaptive equipment. UTIs are the infection of the urinary tract system. There are two different types of UTIs. The upper UTI, which is more pain associated with the kidneys. It's a kidney infection. And then we have lower UTIs, which are the typical UTIs, which have the pain and burning during urination, increased frequency of urination, the lower abdominal pain. In older folks or folks who can't communicate as well, it can result in confusion or behavioral changes, increased falls, a fever, and then changes in the urine itself as well. Anyone is at risk for UTIs realistically. Anyone who holds their bladder for too long is at risk of a UTI, but most people are the ones that have incontinence, limited mobility. They've been catheterized for long periods of time. They have a suppressed immune system or a spinal cord injury or bladder injury of some sort. Dehydration is when we lose more fluids than we are taking in. We need water. The lack of water in the body may result from either a decrease in fluid intake or an increase in fluid loss. So dehydration is most commonly caused by excessive diarrhea and vomiting. The symptoms are usually very concentrated, dark yellow urine, a dry mouth and nose, dry skin, decreased tear production, headache, dizziness, sleepy, tired, lightheaded. It's important for everyone to stay hydrated, obviously. Some people cannot tolerate as much as 8 cups of fluid a day and must have restrictions. But good hydration is important with or without a G-tube, especially if a person drinks thickened liquids. Some people may have difficulty swallowing, which can lead to a decrease in fluid intake. And if caring for someone who cannot communicate, to ask for something to drink. Remember to offer fluids frequently, like every hour, to keep them hydrated. We have to consider constipation and bowel obstruction. Constipation is the slow movement of feces through the intestine, which results in infrequent bowel movements and hard, dry stools. It's very uncomfortable. The signs are changes in the frequency of using the restroom, how the bowel movement looks, dry, hard, lumpy stools, difficulty passing the stools, belly pain, especially that's relieved by bowel movement, bright red blood in the stools, or lots of leaks of wet diarrhea-like stool between regular bowel movements. People who are at risk are usually the ones who have had recent diet changes to low fiber, high fat, high refined sugar, excessive caffeine. Folks that lack regular exercise or are inactive or immobile, who don't have adequate fluid intake and hydration, people who are stressed, take medications, have poor bowel habits like holding back bowel movements, those who are older who use laxatives or enemas. Those folks are all at higher risk of bowel obstruction and constipation. And then we have sepsis, which is a serious medical condition caused by an overwhelming immune response to infection. Sepsis can arise unpredictably and can progress rapidly. Sepsis springs from 2 factors, an infection and a powerful and harmful response by the body's own immune system. There are stages of sepsis. So there's sepsis, which has the fever, increased heart and respiratory rate, probably infection. Then severe sepsis, which is when there's a decreased urine output, your mental status starts to change, platelet count decreases, difficulty breathing, abnormal heart pumping function, and then we go into septic shock, which is severe sepsis, symptoms, plus extremely low blood pressure that doesn't respond to simple fluid replacement. It doesn't respond to treatment. People who are most at risk for sepsis are those with weakened immune systems, chronic illnesses, severe burn or physical trauma can result in sepsis, or an infection can result in sepsis, such as pneumonia or UTI. And then we have seizures, which are defined as abnormal movements or behavior due to electrical activity in the brain. Seizures might include shaking and convulsions and can last from a few seconds to over 5 minutes. Signs of a seizure include, but are not limited to, a blackout, followed by confusion, changes in behavior, drooling or frothing at the mouth, eye movements, shaking of the entire body, grunting or snorting, falling, teeth clenching, tasting a metallic flavor, uncontrollable muscle spasms, jerking limbs, mood changes. And the people most at risk for seizures are those who have epilepsy or a history of seizures, had a brain injury, had a brain infection, had a stroke, brain tumor, those with Alzheimer's diseases, and then other genetic factors can contribute to somebody's likelihood of having a seizure. This is our overview of health and safety. You're going to find 2 follow-up additions on our health and safety training, which are for choking and for changes in mental health status. Make sure you watch those videos and complete all of the quizzes. Good luck.